I will be covering the bones of the thoracic cage, a division of the axial skeleton system. The thoracic cage forms the chest portion of the body, between the neck and the abdomen. It is a cone-shaped, cage-like, bony, and cartilaginous structure. Its function is to protect the organs and major blood vessels of the thoracic cavity, most importantly, the heart and the lungs, and it also supports the shoulder girdle. The part of the thoracic cage that opens into the neck is called the superior thoracic aperture, and the bottom part of the thoracic cage is called the inferior thoracic aperture, which is closed by the diaphragm. The bones of a thoracic cage are formed by the sternum, 12 thoracic vertebrae, 12 ribs, and their costal cartilages. The sternum, also known as the breastbone, is a flat bone that anchors the midline of the anterior thoracic cage. It is this bone here. It is connected to the first 7 pairs of ribs through costal cartilage. The sternum is fused by 3 bones: the manubrium, the body, and the xiphoid process. Here's a quick fact. The sternum can be cut in half longitudinally to gain access to the thoracic organs for surgery. The manubrium is the superior, wider portion of the sternum and articulates with the clavicle laterally and the first rib and lies opposite to T3 and T4 vertebrae. The manubrium has an important bony landmark, an indentation at the superior end called the jugular notch, also called the suprasternal notch, which lies over the trachea. The body forms the largest part of the sternum and is fused with the manubrium at the sternal angle. The sternal angle articulates with the second rib and provides a reference for the second intercostal space, which is the space to listen to certain heart valves. Here's a quick fact about the sternal angle. It is an important landmark for thoracic surgery. The body of the sternum articulates with the second, third, fourth, fifth, and sixth ribs through the costal cartilage. The inferiormost portion of the sternum is formed by the xiphoid process and is fused with the body at the fisternal joint. The fisternal joint lies at the 9th intercostal thoracic vertebrae. The xiphoid process lies at the 5th level of the intercostal space. Here's a quick fact about the xiphoid process. It is made of hyaline cartilage in children and ossifies as an adult. In some people, it projects dorsally, which may present a disadvantage to those with physical trauma to the chest, causing the xiphoid to push down into the heart or liver. Now the ribs are flat, curved bones that consist of 12 total pairs of ribs on the left and right side and articulates posteriorly with the T1 through T12 thoracic vertebrae via their heads. The ribs have a head, neck, tubercle, shaft, and angle. Most of the ribs attach directly or indirectly to the sternum by costal cartilages. The costal cartilages provide the thoracic cage with elasticity, allowing to expand during respiration. The numbering of the ribs begins with the most superior most pair of ribs and proceeds inferiorly with the 12th pair of ribs being the most inferior ribs. The rib can be divided into three different parts: the true ribs, false ribs, and floating ribs. The first 7 pairs of ribs, 1 through 7, are called the true ribs, or vitrosternal ribs, and attached directly to the sternum by their own costal cartilages. The next 5 pairs, 8 through 12, are called the false ribs, or vertebrosternal ribs, and are attached indirectly to the sternum via the costal cartilages or lack an attachment to the sternum. The last 2 pairs, 11 through 12, of the false ribs are called floating or vertebral ribs and have no sternal attachment or costal cartilage. I hope you have found this video useful, and thank you for watching my video, Bones of the Thoracic Age, Anatomy 101.